Endometriosis is a very common disease. It probably affects 10% of reproductive age women, and it can be quite debilitating. Unfortunately, we don't diagnose it soon enough. There's an average of a 7 to 10 year delay from the time someone first has classic endometriosis symptoms until we make the diagnosis and get them on effective treatment. That 10 years is just too long. These are young women, often at very formative stages of their lives, sometimes in school, sometimes in their early career. And they just miss out on opportunities. They never achieve their full potential if they're not able to participate fully because of the pain. We need to do a better job identifying this disease earlier, making a clinical diagnosis, and beginning treatment. It's not hard to make the diagnosis. Often these patients have progressive cyclic pelvic pain. Somebody who has dysmenorrhea, their menstrual pain is getting worse over the years. It's a clear sign of endometriosis, and we can make that clinical diagnosis and begin therapy right away. Thankfully, just in the last couple months, ACOG has made that change in their recommendations. They now advocate for a clinical diagnosis of endometriosis based on signs and symptoms, physical exam, and imaging if necessary. You can make the diagnosis of endometriosis based on your clinical judgment and begin treatment. One of the big barriers was when surgical diagnosis was necessary, only those who had the most severe pain, who got to the point where they're willing to undergo surgery, got diagnosed. That's no longer necessary. ACOG now recommends clinical diagnosis and treatment of endometriosis based on that clinical diagnosis. Many of them have had their pain dismissed. If you think about it, dysmenorrhea or menstrual pain is the only pain we as human beings would ever consider normal. Every other pain you may have anywhere in your body, you would assume something is wrong, get it checked out, figure out what's wrong, and try and fix it. This is the only pain we consider normal, and pain is subjective. How do you know if your pain is worse than someone else's? It is too easily normalized and dismissed. Most of my patients, when they first tell their friends, family members, and sometimes, unfortunately, even their healthcare providers about their menstrual pain, it's dismissed. They say, everyone has some menstrual pain, some cramps with menses are normal, just get on with your day. It really is very difficult for these patients and so hard for them to have that dismissed. It's often not until they have debilitating pain where they're not able to even go to school or work that it's recognized as something abnormal. I'd like to change that conversation to, if your menstrual cramps are progressively getting worse, that is not normal. Menses aren't supposed to get worse over time. If they're getting worse over time, probably endometriosis. Let's simplify this diagnostic dilemma so we can get patients diagnosed earlier, get them back on their proper normal life trajectory. They're missing out on career and educational opportunities that they may never get a chance to do over again. Let's get them back on track and let them achieve their full potential. The other thing we see often is when endometriosis is not recognized is they get all sorts of other diagnostic workups. And that diagnostic odyssey can include perhaps they have some GI symptoms that are due to their endometriosis, but they see a gastroenterologist and get a colonoscopy. Or they have some bladder pain, they see a urologist and get a cystoscopy. Or they have some depression or anxiety, which are more common in women with endometriosis, and they get sent to a psychiatrist. This is really not necessary. Let's get back to focusing on one diagnosis, a single disease that is endometriosis, that encompasses many of the other problems, and get away from this expensive, inconvenient diagnostic odyssey that just delays the real diagnosis of endometriosis.